Worldwide, cardiovascular disease affects the lives of hundreds of millions. Dedicated CardioNerds everywhere are working hard to fight this global epidemic. These are their stories.
My dear CardioNerds, this is Amit Goyal. Join us on a new adventure as we journey through the maze of clinical practice guidelines. In this series, Decipher the Guidelines, we will take a deep dive into the 2021 ESC Cardiovascular Prevention Guidelines, focusing on similarities and differences from the American guidelines. This is a multidisciplinary collaboration between the CardioNerds, the ACC Prevention of Cardiovascular Disease section, the National Lipid Association, and the Preventive Cardiovascular Nurse Association, developed with the mentorship from Dr. Eugene Yang.
And remember, CardioNerds is a fellow-founded independent educational platform. The views expressed here do not necessarily reflect the opinions or policies of our employers. Do be a nerd and spread the word on social media and help others find us by rating and reviewing the show on your favorite podcast platform. And with that, it's time to get nerdy. The following question refers to Section 4.7 and Table 18 of the 2021 ESC Cardiovascular Prevention Guidelines. The question is asked by student Dr. Shivani Reddy, answered first by fellow at Johns Hopkins Dr. Rick Ferraro, and then by expert faculty Dr. Roger Blumenthal. Dr. Roger Blumenthal is professor of medicine at Johns Hopkins, where he serves as director of the Ciccarone Center for the Prevention of Cardiovascular Disease. He was instrumental in developing the 2018 ACC-AHA Cardiovascular Prevention Guidelines.
Dr. Blumenthal, thank you so much for joining us, and we're really excited to learn from you today about blood pressure control. So for today's question, we have Mr. AC, who is a 78-year-old gentleman with a long-standing history of hypertension, receiving antihypertensive medications and dietary management for blood pressure control. What is the target diastolic blood pressure recommendation for all treated patients such as Mr. AC? Option A, less than 80 millimeters of mercury. Option B, less than 90 millimeters of mercury. Option C, less than 70 millimeters of mercury. Option D, less than 95 millimeters of mercury. Or option E, less than 100 millimeters of mercury. So Rick, could you help us out here? What's the correct answer going to be?
Absolutely. Thanks so much, Shivani. And this is another really great question to highlight some important principles. So the correct answer here is A, a diastolic blood pressure of less than 80 millimeters of mercury. And we'll talk about why that is and why that's important to Mr. AC. So blood pressure treatment targets. When drug treatment is used, the aim is to control blood pressure to target within 3 months. Blood pressure treatment targets in the 2021 ESC Prevention Guidelines are more aggressive than previously recommended, as evidence now suggests that previously recommended targets were too conservative, especially for older patients. And that's important for a patient like Mr. AC, who is 78 years old. The magnitude of blood pressure lowering is the most important driver of cardiovascular benefit. It is recommended that the first objective of treatment is to lower blood pressure to less than 140 over 90 millimeters of mercury in all patients, and that subsequent blood pressure targets are tailored to age and specific comorbidities. And that's a class 1 recommendation by the guidelines. In treated patients aged 18 to 69, it is recommended that systolic blood pressure should ultimately be lowered to a range of 120 to 130 millimeters of mercury systolic in most patients, another class 1 recommendation. In treated patients aged greater than 70 years old, the recommendation is that systolic blood pressure should be targeted to less than 140 and down to as low as 130 if tolerated. And that's also a class 1 recommendation and something that would apply to Mr. AC here. In all patients, diastolic blood pressure is now recommended to be lowered to less than 80 millimeters of mercury. And that is also a class 1 recommendation by the ESC guidelines. This change in the blood pressure target range for older patients compared with that of the 2016 ESC prevention guidelines is supported by evidence that these treatment targets are safely achieved in many older patients and are associated with significant reductions in the risk of major stroke, heart failure, and cardiovascular death. It also takes into account that even lower systolic blood pressure in the intensively treated group in a major trial sprint, the systolic blood pressure intervention trial, which had a mean blood pressure of 124 millimeters of mercury systolic, probably reflects a conventional office systolic blood pressure of 130 to 139 millimeters of mercury. It is recognized, however, that the evidence supporting more strict targets is less strong for older patients, in particular those above the age of 80 years old, and those who are particularly frail. Also, in these older and frail patients, it may be difficult to achieve the recommended target blood pressure due to poor tolerability or adverse effects. And high-quality measurement and monitoring for tolerability and adverse effects is especially important in these groups. So these are people who we want to be monitoring closely and arrange for a close follow-up. So the main takeaways of this question are the first step in hypertension management in all groups should be a reduction in systolic blood pressure below 140 millimeters of mercury and diastolic blood pressure below 80 millimeters of mercury, with further targets depending on age and comorbidities as specified in particular by Table 18 of the 2021 ESC Prevention Guidelines, where I would refer you to after listening to this episode. I'm excited, though, to hear more from Dr. Blumenthal on this issue. Again, a true expert and luminary in the area that can maybe shed a bit more light on this recommendation.
Well, Rick, thanks so much. As we all know, the diastolic reading is the pressure in the arteries when the heart rests between the heartbeats. And that's the time when the heart fills with blood and gets oxygen. And as we get older, our diastolic blood pressure actually tends to drop. And it would be rare for someone who's 75 or older to have diastolic blood pressures of 90 or higher. And we still have all these debates that a lot of academics at Hopkins and elsewhere, Cleveland Clinic, like to have about how low is too low for the diastolic. And a lot of us who treat heart failure patients are pretty skeptical about some of the older ideas that if you get your diastolic down below 65, you're actually harming the patient. Because we really know, Rick, that in heart failure patients with heart failure with reduced ejection fraction, that we're trying to add on the RAS blockers, the beta blocker. We may be switching to an ARNI. And many times we'll have systolics in the 100, 105 range, sometimes even the 95 range. And if you do a manual blood pressure, I can pretty much guarantee that many of these patients have diastolic significantly below 60 or 65. So I think as long as you go relatively slowly with the blood pressure medications, there's really not a good case to say you're harming the patient if you're getting your diastolic down below 60. And I'd be curious, Rick, what your thoughts are. In clinic, I always find that the automatic blood pressure cuffs that we use at the Hopkins Outpatient Center at Green Spring typically register significantly higher diastolic readings than when we listen manually. So I'm always a little bit skeptical about the automatic blood pressure readings, but we tend to teach trying to get to that systolic target. Ideally, we say a normal blood pressure is less than 120/80. And if you get that systolic down to that 120 range, it's pretty rare in an older patient like this that you're going to have to worry that their diastolic is too high. So, in essence, I think it sort of takes care of itself. If you get the systolic down, you're rarely going to see diastolic hypertension alone. And if you find that way with the automatic blood pressure cuffs, I would suggest that you do it the old-fashioned way with your stethoscope and listening to when those carotid cuff sounds are smothered and then go away. So in essence, remember that 120/80, we have sort of that fudge factor written into the guidelines that we say less than 130. And keep in mind that there's always going to be a little bit of a variation. And if people are sitting still for 5 or 10 minutes, it's typically going to be better readings than if they were just sitting still for 2 or 3 minutes. And so in essence, diastolic hypertension is pretty uncommon in people over the age of 75. And even when you have to deal with hypertension, always remember the ABCs. And at the end there, we have the diet, weight, and the exercise. And so many times improvements in those areas will allow you to need less pharmacologic therapy.
Thank you so much, Dr. Blumenthal, for sharing your expertise with us and for reminding us about a few pointers to ensure that the blood pressure readings that we do record are as accurate as possible.